What's going on, guys, and welcome back to the podcast, the world's okayest physical therapist podcast, hosted by me, Dr. Hint. Today, we're taking a look at how AI is already changing physical therapy. But first and foremost, please don't forget to like, comment, subscribe, and share this with everyone you know to help everyone learn how to navigate this Byzantine, labyrinthine thing we call the American healthcare system, because that's what I'm here to do, is to share my experience with you guys and my knowledge and my education with you guys so we can all live happier, healthier lives. You already know that there are discount codes waiting for you in the description. Go check them out. Let's not waste time. Let's get into the meat and the potatoes of today. So I know what you're thinking. Is AI going to replace physical therapists? Are robots going to suddenly be in the clinic doing soft tissue mobilization or massage or joint mobilization or helping me do my sit to stands? And honestly, no. I do not think that's the future of AI and physical therapy. I do think the future of AI is going to be impacting documentation. It's going to be impacting what a physical therapist does in their off time too, because if the AI can go through and sort research and provide, hey, here's the newest study on this, that, and here's why it was done, here's what their outcome was, here's how you can apply it to certain patients, that's where I think it's going to show up. I think it's going to be like that little Microsoft paperclip back from like Microsoft Word 2008, where it kept giving you suggestions, and some of them were helpful and some of them were absolute garbage. That's what I think the future is for AI. Not to mention also some of the tools that are already out there, like gait analysis, running analysis, and things. But I'm getting ahead of myself. Let's dive into it. AI is already here. It's already impacting how physical therapists work, and I believe it's going to help raise the bar. It's going to help raise the average physical therapist to be a great physical therapist. So let's start with what's already here, documentation. I don't know a single physical therapist who doesn't spend extra time after work doing notes. I mean, what do you think I was doing right before I did this podcast? Notes. AI powered voice recognition and documentation tools are being created and are already being implemented that are helping physical therapists cut back on the amount of time they have to spend doing notes, which means they get to spend more time hands on with their patients. Some systems even can suggest billing codes that can help a physical therapist even skip that step and then go straight to just submitting documentation, which saves the physical therapist time. Because I personally will spend probably 2 or 3 hours outside of the clinic doing notes per week if I'm lucky. Because some of the patients that I have, and it depends on the week, are very complex and it requires a lot of communication outside of the time that I spend with them. Next, you have movement analysis, like I said earlier. There's computer vision systems that can very quickly analyze gait and running, jumping, all sorts of movement patterns with very good precision. They can track joint angles, measure asymmetries, and they can identify I can never say this word, compensatory patterns that might get past a physical therapist. That's something that AI is really good at, is taking a look at those movement patterns, breaking them down and saying, here's exactly all the fine details that I see. How to cue to correct those things a lot of the time is the art of the physical therapist. Because that physical therapist will look at that and say, yes, I can see that they're having this much excessive rotation in the shoulder, or they're having significant scissor gait with walking, and they're having some medial whip with running. The physical therapist can take all that information that AI just gave them in maybe a minute and say, all right, I know exactly how I'm going to tackle these things now with my patient. I think the AI can probably make a decent suggestion. The question is, can it rack and stack what the biggest impediments and limitations are as fast as a seasoned physical therapist with good clinical reasoning can, and still achieve the same outcome. And I think a good seasoned physical therapist will take one look at what the AI told it and already know how they're going to solve the problem with better time-proven solutions than the AI will, because one, the studies and the data that AI relies on are not there yet, and two, the AI probably isn't being taught to problem solve, it's just being taught to analyze. So there's some inherent limitations there. But having that AI-powered tool in the pocket of a physical therapist is nothing but a bonus for the patient and the physical therapist themselves. Next, in treatment planning support, there are already AI systems that are being developed that can analyze patient data, including, let's say, their DNA, so um, whatever their um, race is, whatever their genetic history is, whatever their conditions are, whatever their current physical therapy diagnosis is, any imaging that they have, any previous treatments, any medications, all of these things coming out. The AI can crunch all those numbers, comparing with other people of similar ages, similar backgrounds, so on and so forth, and then come together and say, hey, here is what we have seen for patients this age with these criteria that helps get them better. That's not the AI making the decision for a physical therapist, but it is suggesting to the physical therapist what it thinks based on the data that it has is the best outcome. And that's where I think it's going to be like that paperclip from Microsoft from 2008. It's going to pop up. It's going to have some suggestions. Some are going to be really good. And you'll be like, yeah, a semicolon does belong there. You're right. And others are going to be like, what are you talking about? That makes absolutely no sense. And you completely misunderstand my intent. Next, what lies ahead? So that's what's already going on and slash already being implemented and kind of in the beta testing phase. What's on the horizon? Imagine predictive analytics for injury prevention. Now, again, some physical therapists already do this. We can already do an injury screen to say, hey, we're seeing this, that, or that, and this is going to drive you likely into what we call dysrhythmia, or it's going to set you up for likely injury in the future because you have weakness here or there. If AI models can get to the point where they can analyze an athlete's movement patterns, training load, current levels of strength, previous injury history, and biomechanical data, they could likely provide individual risk assessments and provide that to a physical therapist or an athletic trainer before anything happens. That would be extremely powerful. That would allow physical therapy in some areas to shift from a reactive to a proactive care. Now, this is true for athletes, and I think that's where the money's going to go. I think the NFL, the NBA, NHL, you name it, cricket even overseas, and especially soccer in the Premier League, they're going to spend big money on trying to do preventative instead of reactive, especially with the amount of ACL tears and stuff, meniscus tears, all these things going on. It's true, like in some sports like football, you just can't account for that because sometimes you take a bad hit. But with soccer and baseball or basketball, for example, some of those things, it's going to be able to help analyze that athlete and say, listen, they've been playing this many games with this many hours per game straight with this weakness here and this weakness here. Yeah, we're looking at the high chance of an ACL injury. But that's not going to be the only revolutionary impact, I believe. If this can come to the elderly population, you are talking about saving lives. You're talking about helping prevent falls, which prevent fractures, which prevents early death. So that's where I think of how AI can help if it can go in and do these things. Another thing it can do is offer personalized treatment optimization. This is where I think it's definitely not quite there yet. Because right now, as a physical therapist, you have to use your clinical reasoning, evidence-based practice, your personal experience with the patient, all these things to help drive what the best treatment is for them. And part of why that's so important, I hate to say it this way, part of why it's so funny is I don't think the computer is going to realize that when you give patients exercises, they're just not going to do them. AI can't force anyone to do anything, but a human being with accountability and a good therapeutic alliance can definitely get patients to do some things. An AI just saying, here is your exercises, is not really going to be, I think, as compelling as having a human being, which is why I don't think outcomes driven from AI is going to be as good. But that's why I don't think it's going to be as good at doing personalized treatment optimization. Now, I think it will suggest good personalized exercises and interventions for patients that a PT can then take as a recommendation and implement or not. That might be important and that might be super helpful, but I don't think until AI can crunch every single exercise that has ever and will ever exist and provide that to a patient or physical therapist in a compelling way of why a person should do that exercise at whatever dosage, I just don't see it. but I do think it will help bring into attention specific interventions that are most likely to work for that specific patient based on their unique presentation and characteristics. And over time, as you work with the patient, I think the AI will be able to narrow down visit on visit the most important exercises for them to do going forward. I think, though, however, as much as we would all love an AI that can tell us exactly what exercise would best benefit our patient, I think the answer will actually be the AI will be saying you should be trying to target these types of muscles, this collection of muscle, this group of muscles, the hip abductors, the hip flexors, the hip extensors, whatever. I think that's where it's going to eventually settle. I don't think AI is going to give you exactly the right exercise to do. I think it will help you narrow down and say, no, 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 this is actually the muscle group we should be looking at, which will be helpful. There's also the potential for remote monitoring that's very useful. Physical therapists could have patients wear sensors that track their movement quality, their pain levels, their adherence to home programs in real time, especially if they're being monitored via like a webcam. And the AI can flag concerning patterns and then help alert a physical therapist that someone needs a check-in rather than waiting for their next scheduled appointment. So if you had someone wear some sort of wearable technology and do their sit to stands, do their side steps, do their shoulder exercises, whatever it is. If a patient is doing their home exercise at home, or if you are doing telehealth, for example, if that ever makes a comeback, having patients wearing wearable technology powered with AI can allow you to do a lot of assessment of how their body is moving in 3D. And then, like I said earlier, it helps you with like fall risk and all sorts of things, and it um, helps you be a little more proactive, preventing either bad movement patterns from happening or correcting them, or recognizing when a patient is seriously at risk. I think that's going to be something you probably see more in home health, honestly. And if telehealth comes back, that's something to be honestly an application I just thought of that it would probably work really well in is any sort of group fitness um, or group physical therapy session, because there are types of physical therapy that can be done in a group setting. If you have that many people that you're trying to keep track of, and it's really hard to, having AI powered wearable technology track every single patient's movement so you can run over and correct them or talk to them about why what they're doing is putting them at risk for fall or whatever, that's going to be super powerful. And again, it's just going to raise the bar for all physical therapists for the care that they're giving. Um, Here's something that it can also do, possibly. It can help tackle healthcare disparities. It's possible that there could be an AI powered telehealth rehab program that's able to deliver high quality physical therapist guidance into rural and underserved communities where access is limited to. And again, that comes down to kind of what I was talking about earlier, um, the elderly population or the underserved population. It allows physical therapy to go into those situations um, without a physical presence and still provide benefit and either help with rehabilitation or preventative care. This is something I think you'll probably see pick up the most in home health group PT classes, and most likely, at least from my experience, Veterans Affairs. Um, just because so many veterans live so far and so spread out, if they can find a way to do like wearable technology onto patients and then have them tracked via camera, um, especially older soldiers, sailors, airmen, and Marines, I think that would save the VA tons of money. It'd save the patients a ton of money because they wouldn't have to drive back and forth, and it could still allow for better outcomes than them having to drive 4 hours one way to get their nearest VA for that one physical therapy appointment once a month. So you can see in how all of these settings, AI is never going to replace a therapist, but it is going to extend the reach of the physical therapist, and it is going to raise the bar with just the sheer number of suggestions and data analysis it can do, and then provide a condensed breakdown of what it thinks this patient with this condition could benefit from. So what can AI not do? Let's harp on this again. It cannot build a therapeutic relationship. It cannot sense when a patient is holding back information. It can't notice the subtle changes in a demeanor when they're not telling you something or when they're far more anxious than they're letting on. It can't help with apprehension. It can't help with fear, and it can't help calm a patient when they're having restricted motion. It can't help provide encouragement in any specific way that resonates with a specific person on a specific day at a specific time. It's just not going to be able to because it's not human. That means AI cannot do manual therapy, not in any meaningful way. It cannot put its metaphorical or literal hands on someone and help guide them through emotion yet. It can't go through and sense the difference in tissue densities that mean that there's a trigger point present. It may be good for helping someone like move their leg if it's strapped into like a knee extension and knee flexion machine, but it can't go through and provide verbal and tactile cues like a human being can. All of that requires human judgment, tactile feedback, and real-time adaptation that AI is nowhere near close to replicating. It just can't handle that complexity. Our patients aren't just biomechanical problems to solve. They aren't just clocks that have a gear loose or a screw loose or a cracked watch face. They have fears, motivations, social context, and complex medical histories and personal stories. AI might help us process the raw information about them, but it's not going to tell us who they are, and it's not going to help us, or it's not going to replace us in integrating everything that a human being is into a holistic treatment approach that requires the human clinical reasoning. Perhaps most importantly, AI does not have the ability to advocate for patients like a real physical therapist does. It cannot fight with insurance companies, it cannot coordinate care across providers, and it cannot adapt treatment plans based on a patient's financial constraints, transportation challenges, and or daily presentations. Because, let's be honest, everybody can change day to day and even inside the same treatment session. So how are we going to prepare for this shift? First, physical therapists are going to have to get comfortable with technology, and so are their patients. That doesn't mean people are going to have to learn programming, but it does mean that physical therapists and the companies in which they work will have to get comfortable with new digital tools and even real wearable technology tools in order to understand the basics of how AI can work to increase their therapeutic abilities. Second, physical therapists are going to have to double down on their human skills. This cannot make them more robotic, or else they will fail. As AI handles the more routine tasks of data analysis and documentation, that leaves squarely on the physical therapist's shoulders the uniquely human aspects and the art of what physical therapy is, and that's what will make them more valuable. It will be your ability to understand, connect with, and to figure out what's driving your patient's dysfunctions. It's going to be your clinical reasoning and the physical therapist's adaptability and reasoning that are going to be the competitive advantages. And that's going to be something that's going to really separate some physical therapists from others. Some are going to have this clinical reasoning and this adaptability innate in who they are that's going to make them infinitely more powerful than they were before, because now they're going to be unburdened by just having to do the mundane notes. And they're going to be literally unshackled from those tasks and be able to focus 100% on their patient and the time that they spend with them. The other thing it's going to do is it's going to possibly help physical therapists learn. Because when they encounter these AI tools, it's going to prompt them to ask questions. What was this data trained on? What are the limitations of this AI model? How can I verify these recommendations that the AI is giving me? All these are going to drive the physical therapists to have questions, which is going to make them want to do more research, which is going to help them be more analytical and more critical, which is very good for everybody involved. Because the more they ask these questions, the more they're going to learn, the more they're going to have a reason and a justification to themselves and to their patients and to their bosses why they're doing what they're doing. Physical therapists need to be informed on these technologies, not just passive consumers. And I think because of how physical therapy is structured, that's going to happen. Physical therapists already want to have the newest cutting edge studies and documentation, breaking down how the studies did what they did in order to see if it's relevant for them or their patients. And finally, it's going to drive physical therapists to get involved into how AI is being shaped for their field. Professional organizations need physical therapists at the table when these systems are being developed and regulated and updated. If physical therapists are not part of that conversation, the decisions will be made without them, and then it'll be forced upon them later. But I think, at least in part, physical therapists are up to the task and will be sitting at those tables. It'll just be a question in what capacity. Were they brought in at the end of the program where it's like, all right, we're implementing this now, it's time for you to tell us what you think? Or is it very early on where it's a tool developed specifically for physical therapists by physical therapists? And the truth is, with the AI boom that we're seeing, all the above is going on at the same time. And it's going to just eventually probably boil down to different companies acquiring different AIs, merging them into one, and having them provide a whole suite of different skills, analyses, and benefits to people. So eventually, at the end of the AI race, it's probably going to be just like the different cell phone carriers we have now. There's only a handful of them that are left. They have bought up and absorbed all the others and took all the technology with them, and now they've provided services. That's how I think AI will end in healthcare as well. But in the meantime, there'll be a huge boom of everybody trying to figure out how it works and those companies buying each other up. So look, I genuinely believe AI is going to make physical therapy and physical therapists better. It's going to free them from a lot of documentation burdens. It's going to give better data quicker to the physical therapist to have better clinical reasoning. And it's going to help eventually deliver more personalized and better care for each patient because, in effect, AI is just another tool that a physical therapist gets to use to help treat their patient. The future of physical therapy is not going to be human versus machine. It's going to be human and machine working together with the physical therapist focusing on the human connection and the human activity and helping people thrive, while the AI is going to focus on handling the back end of things such as documentation, data presentation and analysis, and providing recommendations. But it's still going to be up to the physical therapist who's in the driver's seat to read, understand, and figure out why the AI is giving the recommendations that it's giving and how it's crunched those numbers and what data set it's pulling from. But the human connection, the skilled touch, and the ability to see and treat the whole person will always remain in the human and physical realm that only a physical therapist can occupy. AI will change the field, but it will not change the fundamental truth that healing happens because it is happening in a relationship, an alliance. And that requires something no algorithm can replicate. It requires a human being who cares. Thanks for listening to the World's Okayest Physical Therapist podcast. If you found this helpful, please share it with everyone and anyone that you know. And if you're already using AI tools in your life, in your practice, or as a patient you've seen them being used, I love to hear about it. Send me a message on any of the social media platforms that you found this podcast. So everybody stay healthy, stay fit, and stay awesome, and I will catch you all in the next episode.